Hello everyone, my name is Emily Bertolato. Today I'll be talking about state scope practice laws and how they impact CRNA autonomy. We'll look at how these laws vary, what that means for our profession and patient care, and what can be done to create a more consistent and supportive practice environment. This is a key issue for both CRNA growth and improving access to safe and efficient care. Scope of practice laws for CRNAs vary widely across the United States, largely due to historical provider hierarchies and ongoing debates about safety, training, and cost effectiveness. In 2001, the Centers for Medicare and Medicaid Services introduced the opt out provision, allowing states to waive the federal requirement for physician supervision of CRNAs. Since then, many states, particularly across the Midwest like South Dakota, have embraced full practice authority, granting CRNAs the ability to assess patients, create and implement anesthesia plans, and deliver care independently. Reduced practice states allow some independent functions, but still require physician collaboration for key aspects of care like prescriptive authority or anesthesia initiation. And then some states like Utah and Wyoming are classified as partial opt out states because they only permit independent practice in critical access hospitals. Restricted states, as shown in red, still mandate direct physician supervision, limiting CRNA autonomy and contributing to variations in patient access and workforce efficiency. State scope of practice laws deeply affect the CRNA profession by shaping how we practice, where we work, and how fulfilled we feel in our roles. In full practice states, CRNAs have the autonomy to use their full skill set, which boosts job satisfaction, reduces burnout, and allows for greater professional growth. But in states with restrictive laws requiring physician oversight, CRNAs often face barriers that limit their clinical decision making, which can feel discouraging and waste valuable time and resources. These restrictions don't just impact us, they also affect the community we serve. In many rural areas, CRNAs are the primary or only anesthesia providers. When outdated laws slow us down, patients experience delays, higher costs, and reduced access to care. Research shows that CRNA only models are both safe and cost effective. As a result, many new CRNAs are choosing to practice in states with more autonomy and leadership opportunities, which is causing workforce imbalances and prompting CRNA programs to tailor training to more supportive practice environments. These laws not only affect the practice, but they also impact patient outcomes. In full practice states, CRNAs can act quickly, especially in emergencies or rural areas, without waiting for physician oversight. Their involvement throughout the surgical process ensures continuity of care, and studies consistently support the safety, quality, and cost effectiveness of CRNA delivered anesthesia. In contrast, restrictive laws can delay treatment, increase costs, and disrupt care, particularly where anesthesiologists are limited. Opponents of independent CRNA practice often cite safety concerns, especially in complex cases, pointing to differences in training between CRNAs and physicians. Others worry about liability or fragmented care without physician involvement. While these concerns are often rooted in traditional or professional politics, they continue to shape policy and hospital practice in many states. Addressing the inconsistencies in CRNA scope of practice laws requires a mix of advocacy, education, and collaboration. National organizations like the AANA must continue pushing for full practice authority, supported by nursing groups, rural advocates, and patients who can speak to the benefits of improved access. At the state level, CRNAs can work with legislators to modernize outdated laws using data and examples from full practice states to show safety and effectiveness. Public education is also key by highlighting CRNA's training, patient outcomes, and the care gaps they fill, especially in rural areas. Encouraging more states to adopt the CMS opt out provision can serve as a short term fix while laws catch up. Promoting a team based, patient centered approach and emphasizing CRNA's doctoral level education can further support the push for consistent nationwide practice standards. In summary, get to know your state laws, get involved, and advocate for the CRNA profession and quality patient care. Thank you.